morning, I'm Kristen. I'm here to draw your blood today.
Good morning.
Could you please state your name and date of birth?
Pat White, November 11th, 1986.
Thank you. Have you had anything to eat or drink in the last 12 hours?
Not since 9 last night.
Thanks. Do you have any questions?
No.
All right, it will just take me a minute to get everything set.
Blood collection by venipuncture is one of the most common procedures performed in a healthcare setting. Common, but also complex, requiring knowledge and skill to assure the accuracy and integrity of the samples drawn and to eliminate risk to both patient and healthcare workers. The first step is to accurately ID the patient using at least 2 forms of identification. Does the name and date of birth on the requisition form match what the patient is telling you? Does it match what is on the patient ID wristband? Has the patient followed special orders, such as fasting prior to blood draw? Address the inconsistency first with a requesting physician or healthcare worker on duty. But if the given information does agree, it's time to prepare yourself and the patient for a successful blood draw using proper standard precautions. The phlebotomist washes and then dons a clean pair of gloves before proceeding. Make sure alcohol prep pads, gauze, tape, the correct gauge needles, and required evacuated collection tubes are within easy reach for you, but out of the reach of the patient. Then speak reassuringly to the patient as you position him for the draw.
I'm all set here. If you'd please straighten your arm. It'll just take a moment while I apply the tourniquet.
Applying a tourniquet slows the flow of blood in the veins and increases venous filling, thus making the veins more prominent, easier to locate, and easier to enter. However, leaving the tourniquet on for longer than 1 minute may affect laboratory test results and should therefore be removed and reapplied if the procedure will take longer than 1 minute. Use your fingertip to palpate the antecubital fossa to locate the median cubital vein. Palpation helps determine the direction of blood flow in the vein, to gauge the vein size and depth, and to estimate its tendency to roll. It also helps differentiate veins from arteries. Unlike veins, arteries have thicker feeling walls and are more elastic to the touch. Use an alcohol prep pad to cleanse the skin around the site. In a fluid, circular motion, swab from the center to the periphery of the site, being careful not to drag the pad back across the cleansed field. Let the area air dry. This prevents contamination of either the patient or the specimen. Grasp the patient's arm firmly with your hand, placing your thumb approximately 2 inches below the intended puncture site. With your thumb, pull the skin taut over the vein to help anchor it in place. Then let the patient know you're ready to make the puncture so the patient won't startle and jump.
You'll feel a slight pinch.
Position the needle bevel side up and line it up with a vein. Position the needle so that it forms a 30-degree angle with the surface of the arm. With a single, short but firm motion, swiftly insert the needle through the skin and into the vein. Push the evacuated tube onto the needle when the needle enters the vein. As the vein aligns with the needle, blood will begin to move out of the vein up into the needle. Maintain a constant, slight forward pressure on the end of the tube. The evacuated tubes are color-coded based on their additives. Know the types of additives and which color tubes are to be drawn based on requisition. As soon as blood begins to flow into the collection tube, instruct the patient to open his hand and remove the tourniquet from his arm. Removing the tourniquet allows the blood to return to its normal rate of flow through the vein and helps reduce bleeding at the puncture site. A gentle mixing by inversion at least 8 times is required to ensure that any additives in the tube are incorporated into the blood sample.
We're almost finished here. Are you doing okay?
Fine.
Engage the safety device on the needle and use the Sharps device for proper disposal. Applying pressure at the needle entry site immediately after removing the needle will prevent a hematoma from forming and allow hemostasis to seal the wound.
Please keep pressure on the gauze pad for several minutes to ensure that the blood flow stops.
In this illustration, you can see formation of the platelet plug and the fibrin clot. Applying pressure at the needle entry site immediately after removing the needle will prevent a hematoma from forming and allow hemostasis to seal the wound. In this illustration, you can see formation of the platelet plug and fibrin clot. Apply the ID label on the filled evacuation tube and store it for transport to the lab. The label must include at least the patient's ID number, full name, date of birth, and today's date. Using standard precautions, dispose of needles in a sharps container. Dispense of all other used non-sharp materials, including used gloves and gauze pads, in an approved trash receptacle. And disinfect all contaminated surface areas. You've just